So it's rare to be trained both as a pediatric and adult hematologist in the U.S. Medical model. So there aren't very many med peds people. For pediatrics, I think the big difference is that most pediatric hematologist oncologists will do some pediatric hematology even in an academic setting. And that is unless you're at a really big place where they might just do oncology. And that's very different than in the adult academic space where most oncologists do not do any hematology. The community's been different. The community people have historically done both classical hematology, malignant hematology, and oncology. But as more and more community practices are acquired and get bigger, there's increasingly subspecialization in that setting as well. So, we see a lot of people, seeing people that are just oncology focused and they have trouble getting appropriate non-oncology hematology care.
I think this also has something to do with employers, that they expect the doctor see everything. Now we are in modern medicine. Every field you enter is like an ocean. You have to learn just so much. Like if somebody is a lymphoma doctor, you have to learn so much about lymphoma, and then every lymphoma divides into different types of lymphoma, right, Dr. Strouse? So even in benign hematology, there is so much subspecialty you can pursue. And if you don't have enough people who train in this, then we can move the field forward. That's why it took 100 years for sickle cell to get all these different types of newer medications to come out. That's why we are so behind, even with thalassemia, with sickle cell, all these benign hematology, because there's not enough experts to think about new things and move the field forward.
I think, the oncology and classical hematology are very different. So classical hematology, there's a lot of, sometimes we struggle with diagnosis. There's less of that. Oncology is mostly about the treatment and supporting people through high intensity treatment. And they're different skill sets. And certainly some people are excellent hematologists, oncologists, but we do find that for things that people see less of, they don't know as much about. And, I feel as like for sickle cell disease, I feel much more comfortable than providing excellent care than even for thrombosis, which I see a fair amount of, but it's not my area of focus. So I think it's hard to be excellent in all areas. And often we see people with rarer hematological disorders where a provider might only have one or two patients that maybe they aren't receiving the same level of care they would if they were seeing someone who took care of a lot of people with that condition.
Well, I think at least what ASH is doing is really good, because they also, if you read about this project that they have started about training new hematologists, you see that they also say that these programs are supposed to be funded if they have a kind of innovative and rich in training for for classic hematology. So that is the difference between these programs that ASH is funding compared to every other hematology oncology training. So these fellows that get under training are supposed to have extra classical hematology training. Now, how much they can achieve, I don't know. These people are going to be trained and graduating in another year or two. Then we will see. But I think it's a good start.